Okay, good morning. We'll go ahead and get started. So I'm proud to start this morning by saying that Iowa continues to gain momentum in our recovery from COVID-19. Our 14-day and 7-day statewide average positivity rate is 3.9%. Hospitalizations, COVID hospitalizations, are down 90% from the peak in November. And as of yesterday, only one long-term care facility remains on the outbreak list, and no additional positive cases have been reported by the facility since February 17th. We anticipate that just days from now, not a single long-term care facility will be in outbreak status, something that hasn't occurred since the first outbreaks were reported in early April of last year. The vaccine is working, and life is getting back to normal. By the end of this month, every long-term care facility in our state will have completed the federal vaccination program. Currently, vaccine providers are making their final stops in facilities where some residents or staff need their second and final dose of the vaccine. More than 90% of long-term care residents and approximately 60% of staff have chosen to be vaccinated. And it's made a tremendous difference in protecting our most vulnerable Iowans from the virus. Nationwide, more than 3 million doses of vaccine have now been administered within nursing homes through the Federal Long-Term Care Pharmacy Partnership, which last week prompted CMS and the CDC to finally expand long-term care visitation options, which have been limited for nearly a year. The updated guidance released last week allows responsible indoor visitation at all times and for all residents, regardless of vaccination status or resident or visitor, with some exceptions. Finally, families can be reunited with their spouses, parents, and grandparents in person and without barriers. While we've celebrated some important milestones in our COVID-19 recovery over the last few weeks, I can't think of a single one that's brought more joy than this one. Today, I'm pleased to welcome Danny Etema, administrator of Hawkeye Care Center in Dubuque, and that's a senior living community that accommodates a variety of living options, including assisted living and long-term care. On Monday morning, Hawkeye Care Center reopened visitation for their residents, and I've asked Danny to share their experience, how they prepared to reopen, and the reunions that have occurred since. Danny?
Thank you, Governor Reynolds, for this opportunity to share our story. We had our first case of COVID-19 in long-term care in Iowa 1 year and 1 day ago today. Then the federal government closed all visitation to nursing homes. We were not able to give any type of notice to our families. That day, no one would have expected us to be doing this for a full year. Since that time, our residents, staff, and families have endured one of the most difficult times of their lives. Thank you to all the staff at Hawkeye and across Iowa for serving as surrogate families to our residents for this tremendously long year. We were the residents' everything in 2020, from cutting hair to celebrating birthdays and every holiday in between, teaching them new technologies, Zooming, calling, FaceTiming, visiting through a window, whatever it might take for them to visit their families. However, our residents are ready for us to be caregivers again. They were more than excited to find out we would be the first on the list to receive the vaccinations. You would have thought we were giving them a winning lottery ticket. Our staff lined up to get vaccines knowing they were protecting our residents, that they could finally see the families again. Once residents were vaccinated, they wanted to know what's next. When does my family get to come in again? Last week, when we heard the news, we were able to open up again. Our residents and families could not wait to come in and visit. Once the email went out about visiting, we immediately started getting phone calls. In the beginning of the pandemic, I remember a husband telling his wife that this was just like when he was going into the service. He was going away, but he'd be back when he could come in safely. He came back, just like he had done many years ago. Dorothy, our 100-year-old in 2020, who could not have had any visitors inside during the last year, told me when her family was able to visit on her 101st birthday, it was like she was a new woman. Sure, they talked on the phone and through the window, but nothing beats seeing your family in person. It amazed me that she was so positive about the situation, and she felt brand new again at 100. Betty told me it's the best heart medicine you could ever get. She Zoomed her family every day, but had tears of joy in her eyes when she saw her son and daughter-in-law in person for the first time in a year. I witnessed a daughter come in to see her mom for the first time in the year. It made my heart ache that they had missed a whole year. We all cried. I think after a year of being apart, our residents and families have sacrificed enough. They're so overwhelmingly ready for this next step, words can't even express how excited they are. We're still wearing our PPE and screening everyone who enters the building. In addition, we're still testing our staff according to the county positivity rate, and we will continue to be diligent in this until this is over. We may not be able to get back this year, but we can move forward. This is a great start in moving forward. Thank you for allowing us to share a little bit of our story.
Oh, thank you, Danny. I just appreciate so much you getting on today and talking about the experiences your residents have had in reopening, and just so appreciate the work that you and your team have done over the last year, caring for your residents and really maintaining those connections in the whole host of ways that you talked about. Long-term care facilities have endured some of the most challenging situations throughout the pandemic, and but it is a new day, and reopening these facilities is one of the most welcoming signs of that. So I want to extend my very best wishes to all of your residents and their families watching today. I'm so happy you're together again, and I wish you much good health and to keep that good momentum going. So thank you so much for sharing. I appreciate it.
For having me.
Yesterday, the Department of Public Health was informed that a hardware malfunction occurred at the Mid-Atlantic Data Center, which houses data for the Iowa Immunization Registry Information System, or IRIS, the application used to report COVID-19 vaccine information. The data center has now been restored, and we expect that our vaccine data will be updated later today on coronavirus.iowa.gov and on the CDC's website. Currently, the CDC is reporting that 1.15 million doses of vaccine have been administered in Iowa, which is 86% of all doses delivered to our state, and Iowa currently ranks 5th in the nation. Iowa ranks 2nd in the nation for the percentage of Johnson & Johnson doses administered. Additionally, more than 31% of Iowans 18 and older have one or more doses, and we're 12th in the nation. 17.6% of Iowans 18 and up are fully vaccinated. And that ranks us about 12th in the nation, which we've really made great progress from that perspective. And the clinics, like I witnessed last week, it really helps those numbers. 95.3% of Iowans 65 and up have had at least one dose, and 28.3% of Iowans 18 to 64 at least one dose. We're also seeing positive results from our 211 new Care Navigator program, which schedules appointments for older Iowans that have been unable to get vaccinated. Since starting the service just 1 week ago, 211 has scheduled more than 3,000 appointments for Iowans aged 65 at Hy-Vee and older at Hy-Vee pharmacies. As with any scheduling situation, appointments are limited to the number of vaccine doses that are available. So there are times when appointments fill up in some areas and callers are asked to try again later. However, 211 and Hy-Vee are working together to fix the situation almost as soon as it occurs. Hy-Vee is able to move additional vaccine to communities where demand is higher, opening more appointments in areas of need, and oftentimes they are able to do that just in one day. So that is a tremendous partnership taking place, and they really continue to meet the needs of Iowans that are unfamiliar with technology, and we're really grateful for that. This week, Hy-Vee is holding special clinics or opening additional appointments in select stores to accommodate more than 400 individuals in the Des Moines area and 240 individuals in the Cedar Rapids area who were unable to schedule appointments last week when demand was extremely high. So again, just a great example of them meeting that increased need. I want to thank 211 and Hy-Vee again for their partnership to provide a solution for Iowans with barriers to scheduling a vaccine. And as I mentioned last week, we are also considering this option for additional populations as we see our vaccine supply increase in the coming weeks. So I look forward to providing more information about those plans soon as we continue to see our vaccine allocation increased. Give you a White House update on the call yesterday. The White House COVID-19 response team. Yesterday, we received an update about upcoming vaccine allocations. While next week we expect to receive about the same amount we did this week, things start looking up after that. During the week of March 29th, the federal government is projecting a significant increase in weekly supply, potentially 20 million doses nationwide, which could include 4 to 6 million doses of the Johnson & Johnson vaccine. Then in April, weekly allocations could increase even more, exceeding 22 million doses across the country. As our J&J vaccine allocations pick up, the state will resume vaccinating workers that are employed in food processing, egg production, distribution, and manufacturers as planned. But as I mentioned last week, many employers have kept this the progress going by working with their local public health departments or other vaccine providers to host clinics for their employees. So it's not that it's been completely shut down. They're scheduling appointments as well until we get the increased doses of J&J. To date, nearly 50,000 of the approximately 160,000 total workers in that cohort have now had the opportunity to be vaccinated. Initially, we had projected it would take 5 weeks to vaccinate this entire population. However, with the number of employers that are now taking the initiative to schedule clinics with other providers, we really could complete this phase of vaccination even sooner. And again, that just depends on the vaccine allocation we receive at the end of the month. But if we're able to get what they're projecting, we really will see some fairly quick turnaround in that cohort of that group. More vaccines means opportunities to vaccinate even more Iowans, and communities across the state are partnering to make that possible now and preparing to serve even more people as more doses become available. As I shared last week, I recently had the opportunity to visit some vaccination clinics and see firsthand the way communities are coming together to vaccinate eligible residents in their area. And one of those clinics was at Crossroads Mall in Fort Dodge, where on a Saturday morning, the Webster County Public Health Department was administering more than 700 second doses of the Moderna vaccine to individuals 65 and older. Like many larger towns in rural Iowa, Fort Dodge serves as a hub for its surrounding counties, and the vaccination clinic drew people from up to 100 miles away. Not only does this type of clinic ensure that more individuals are vaccinated in a timely manner, it also reduces some of the pressure on smaller surrounding communities where vaccine supply is most limited at this time. So our goal, of course, is to vaccinate as many eligible Iowans as possible, as quickly as possible, so that the supply increases, that we continue, so that as supply increases, we can continue to expand. Webster County is a great example of how communities are working together to put the infrastructure and processes in place so that they can continue to scale up vaccination efforts as more Iowans become available. Today, I am so pleased to be joined by Kerry Prescott. She's the director of the Webster County Public Health Department, and she's going to share with you how her team is coordinating mass vaccination clinics to best serve their region. Kerry?
Thank you, Governor. Good morning. As the director of the Webster County Health Department, I am honored to speak to Iowans today about the successes and partnerships which have allowed Webster County to succeed in providing over 13,000 vaccinations. The Governor has requested I speak about our community partnerships and our mass clinic operations. I need to stress these important relationships are imperative to the success of our public health department. 1 year ago today, the proclamation was set forth, and all local public health departments were at the forefront of a major pandemic that brought uncertainty, chaos, and fear into our communities. Health departments across Iowa provided information and guidance. Some implemented hotlines, but all answered thousands of questions through telephone and emails. The staff at the department continued to provide contact tracing for the county and was responsible for all isolation and quarantine activities. And now, 1 year later, we are focused on providing doses of hope. I tell you this because our communities have been walking together with local public health, leading the way through this pandemic in our communities. The relationships our department has with our Unity Point Hospital, our healthcare provider network, our school system, our local government systems, and our community in general are the keys to the success in the community during this pandemic, and now as we provide mass vaccination clinics. Our network of workers for our mass clinic includes retired nurses, school nurses, healthcare nurses, local service groups, Board of Health representatives, Board of Supervisor representatives, our own representative, and several people in the community just calling and wanting to help. One of our vital relationships is with our county. Several staff from different departments within the county structure are on site at each mass clinic, entering data or helping with clinic flow. This is vital as it also helps with controlling the costs for our local public health agency. Our mass clinic is located at the Crossroads Mall. The mall is currently in transition and much of the mall is vacant. We have designated 3 pods, which is a point of distribution. Pods are labeled red, white, and blue. The pod system provides us the ability to vaccinate 180 people an hour. This is scalable to the amount of vaccine provided to the county. For example, tomorrow we will be providing 300 vaccinations an hour. We will also test our ability to manage 2 separate manufacturers. We will be providing 1,770 vaccinations tomorrow, which is our total vaccine allocation to the county for the week. We have the capacity to do more if the vaccine was available, and we have the capacity to add another manufacturer. Staffing is streamlined in the pods. Everyone has a duty and follows an incident command. People are ushered to their seat and stay seated until the public health staff person releases them. The entire process takes approximately 25 minutes. While the people on the hour are waiting their 15 minutes, our ushers are already seating the people on the half hour to start the process all over. Our Fort Dodge Fire Department is on site at every clinic. They sanitize chairs and clipboards with the Victory electrostatic gun. Scheduling for the clinics are available either through an online process or a telephone option for those that are not computer savvy. If we identify a person that has a severe complication to get to our clinic, we offer a homebound visit option. Our clinic is open to anyone wanting the vaccination. Webster County is a regional rural hub. Our goal is aligned with the governor's goal to vaccinate as many people safely and efficiently as possible. I do need to take a moment and acknowledge the staff at the Webster County Health Department. I continue to ask of you, and you continue to deliver. Every day for the last year, you continue to show up and meet the needs and the challenges of the day for our community, and for that I thank you. And thank you, Governor Reynolds, for your visit to our clinic and to the other local public health clinics around the state. Thank you for your kind words of encouragement to the public health staff and for believing in the local public health structure, not only in Webster County, but across Iowa.
Thank you, Kerry. And I said it then and I'll say it again. I just really commend you, your leadership and your team, and just the collaboration that I witnessed that day. It was seamless, the way that they were moving people in, getting them vaccinated, answering any questions, and moving them out for the next group to come back in. And we talked a lot about, if you get me more vaccine, we can expand and scale. I promise you we can do that. And they are doing that. And it is a great example of what other communities can emulate as well. And so I just want to say thank you for sharing the information today. I'm confident it will help even more communities that are working to ramp up. And we are seeing that across the state in different areas. So it's really positive to see what we have going on, and especially as we see our vaccine numbers increase. We're going to be ready to go. So I feel very confident in saying that. In the last couple of weeks, more and more people have commented that it feels like we've turned a corner, and I believe we have. Iowa's recovery is in a strong position. We've proven that we can manage the virus while responsibly moving ahead with our lives. As vaccine supply increases, getting life back to normal finally becomes possible. It's something that we've all wanted to happen sooner rather than later, and it's been hard to be patient. But now that our national vaccine supply is projected to significantly increase in the next 2 weeks, and Iowans have demonstrated our ability to work together and ensure vaccine is administered efficiently and responsibly, I'm confident that we're prepared to open up even more. Today, I'm announcing that all Iowans will be eligible for vaccination starting Monday, April 5th, as long as the vaccine allocation increases, as we've been told and as we are expecting. Getting vaccinated is the most important thing that each of us can do to ensure that our state's recovery from COVID-19 is both strong and sustainable. We all want life to get back to normal, for our businesses to rebound, for our high school seniors to graduate together, our church communities to gather again fully in person, and our families to be reunited. All these things are possible, and soon. But like everything else over this past year, it will depend on all of us doing our part for the greater good. So please, let's pledge that you'll be vaccinated as soon as you can and encourage your family members, friends, and coworkers to do the same. And we're all in this together, so let's finish strong together. And I think that we are going to get that accomplished. So with that, I'll open it up for questions.
Governor, there were several polls that came out last week, national polls, and they indicated that Republicans, and a lot of Republican men, were not going to get the vaccine, and a lot of Trump supporters. And I'm just wondering why you think that is, and would you encourage them to change their mind?
Well, I'm encouraging all Iowans to do it. As I just indicated in my remarks, I think it's the right thing to do for the greater good. It's a personal decision. Individuals will make that decision. It's one of the reasons I wanted to also assure Iowans that all 3 vaccines were good vaccines. It's one of the reasons that I got the J&J last week, to show that, I think it is important to get the vaccine. It's why I got the vaccine. It's why Kevin got the vaccine. So we'll continue to educate Iowans on why it's important and why they're safe and why it's the right thing to do. And I think we continue to see, the longer we get into this and more people are being vaccinated, our numbers are really pretty good. I think you'll see more and more people reconsider that and maybe circle back and get the vaccine. So, there's a little bit of that hesitancy at the beginning. We actually saw that in our long-term care pharmacy or long-term care rollout with staff. As we came back a second time for the second dose, we saw more of them step in and get that first dose. So we're still at about 60% there, which mirrors the national average. But I still think we're going to continue to pick those up as we move forward. Anecdotally, I'm hearing really good participation and uptake rate with our educators and staff. So I think that's a really positive thing. So I think if we keep focusing on the positive and and the numbers that we're generating from our population, I think you're going to continue to see that drive up.
Governor, how do you plan on helping Iowans who not only are not that internet savvy, but may not even have a smartphone? Will people under the age of 65 be able to call 211 and get help in scheduling?
So we're looking at that, and we're kind of assessing what that looks like for the next phase. We're going to go another at least full week because there's still a need, and we're seeing increased numbers. And as I indicated, Hy-Vee and 211 are adapting and relocating vaccine where we're seeing some of the larger numbers. And so we're going to watch that closely at least for another week, Kay, and then we'll take a look at that. But I think we all think it makes sense to utilize this great resource to really address maybe some other areas where we can be helpful in helping them get the information and helping them schedule a vaccine. So that's part of the process that we're looking at.
Governor, you said starting April 5th, if all goes right here, it'd be for everybody. So obviously people are going to be pretty excited hearing those words come. But how do they know, when can they start making those appointments, and what's the threshold for our supply that you can pull that off?
So it is based on what they've told us they will allocate, and there is a significant jump starting March 29th where we're starting to see all of them ramp up, as well as J&J, which again, the single dose, that really is a game changer, and we can really allocate and get that out to some of our mass vaccination clinics where they can turn that around pretty quickly. So next week, we'll have the White House call on Tuesday before the press conference next week. So I should be able to give another update to Iowans to what that looks like, to make sure that they've confirmed what they told us this week, that still stands, and possibly, Dave, there could be even some additional vaccines. But I'll know that by Tuesday, so I'll be able to give an update on Wednesday. We're still a full week out to where we could open that up, and I think that will allow us, with the additional J&J, to get in there and get some of the manufacturing, that tier that we're working on, to get them hopefully wrapped up, and then that will allow us to distribute a lot of vaccine throughout the state to meet the needs of everybody else that we're rolling into the allocation.
Are they already giving you specific potential weeklies?
Yeah, projections.
So can you say what that is?
Well, I did. I mean, so this
Like
week
nationally, but what about our states?
Yeah, well, then we get, it's about 10%. I mean, 1%. What did I say, 10? It's about 1%. So, I mean, you can kind of do the math. That's what we're basing on what they tell us and what we've been getting from the projections that are nationally. So you can do the, figure that. And we can give you, let's see, we'll know some of them, not everything will I know all of them by next Wednesday, Kelly? Ideally, I should. They're getting better at that too, as they get them more stabilized. We're getting the notification even sooner, and that allows us to get into the system and allocate it to our local partners so that they can prepare to provide the vaccines to their
So the math
residents.
is 1% of 20 million?
Yeah, right, approximately.
Ramping up fully to
29 million, okay. Ramping up. I mean, it's continually ramping up. The 1st of April, the numbers look really good.
Governor, Iowans have been turning to third-party services put together by volunteers to find appointments for vaccines. Is the state going to change its system at all, like to allay any kind of appointment crunch, especially if we open up to?
Well, it's still a supply issue. So, we're getting the vaccine out. I think some of the numbers are really reflective of whatever comes in, we're getting it out. They're going to, how many did you say you're doing tomorrow?
1,770.
And that's their whole allotment for the week, and they're going to administer those tomorrow. So we're getting individuals scheduled, and I appreciate other individuals that are helping Iowans with scheduling. That's great. I appreciate their efforts in helping their fellow Iowan get an appointment, but we're just still limited by the supply. And so as we continue to see those increase, I think I'm answering your question. We're going to continue to see those open up.
So will Iowans still be hitting refresh on the Hy-Vee appointment website in a couple
Well,
of weeks?
I mean, when they get the vaccine and when they have it available, then you can go on. 211 is an option. You can go on through Vaccinate Iowa. That'll trigger you into their websites. They will, you'll know when they're up, and then, there's just other options that you can, your local public health is another option to help schedule. So it's the same resources that we had to help Iowans get scheduled.
Governor, what's the rationale for the state not disclosing the vaccine refusal rates at the privately run nursing homes? Wouldn't that be good information for consumers to have?
Clerk, we're not custodians of that record, so we disclose vaccination rates at the facilities that we own and operate. So Glenwood, Woodward, the Veterans Home, and we've made that decision because the state operates those facilities. There's not a requirement to report that information to the state, not to DHS, not to DIA, and not to the Department of Health. At any point in time, if the federal government decides to take that information, we would reassess at that time.
Saying, though, that you don't have the information?
No, sir.
You don't have the information?
We do not.
Okay.
Okay, so I guess just not great at math. So we've been getting something like 100,000.
Well, I'm not going to try to do it up here. So let's both agree on that.
We do.
If you need some specifics on numbers, I'll make sure and have the team.
No, I'm just, so we've been getting what, roughly 100,000 doses?
Oh, let's see. I think I
a
do have
week?
some of that. Like March 1st, we got about 118,900 doses. March 8th, it ticked down. Remember, we knew that was going to happen because J&J, there was an influx of that. We're about down to 94,890. This week, do you know the projection for this week? It's not on my notes.
86,540.
I thought it was pretty, 86,540. So, and then, then next week, we'll see that start to,
I mean, it sounds like they're talking about doubling or even, I mean, if you're talking.
it's significant.
Yeah, okay.
Yeah.
Okay, well, okay, that just gives us-
it needs to be a reality.
Right.
But right now, if we're able to ramp up in a manner that they're projecting, and we're ready to go. It'll be good news for Iowans.
I guess it's just some of the questions have been asked here. So you feel confident that we have the system in place that if everyone is eligible for a vaccine in Iowa as of April, there will be a system there
Yeah.
to get people
Well, we're
logged
working on it
in?
every day. So
Okay.
every single day, the team looks at what we're doing, looks for opportunities. That's why I had Kerry here today to talk about what they've done and say, here's what's possible. And if we can be a help in facilitating that as we start to see our allocations increase, there will be opportunity for that to happen. So, you know, we're working on different partners, whether it's United Way, whether it's our hospitals, our local public health. They're doing the same thing. We talked about the clinic last week with Vermeer, and, you know, they have a lot of capacity to be able to increase as well. I think this is the largest public health vaccination clinic, though, to date. So she's kind of set a marker here. But so we're continually looking for those partnerships and trying to be strategic about where we put them. So if we can have some regional hubs, it helps everybody. You can still get some of those vaccines in your individual clinics, but as far as getting a large number done at one time and facilitating that, we're trying to look for where those options are at. I was up in Osage. Was that last Thursday? Yeah. Friday, and they were doing a great job, and we got some extra vaccine up to them too, because they were really serving that region and had just used a lot of volunteer help with 2 retired nurses that were volunteering there to give vaccines. Representative Meyer was actually at the clinic last week giving vaccinations, which was kind of cool. Board of Supervisors.
We have, I mean, is there a mass location that we're
Well, you
thinking
know,
of in a
Polk
large
County
metro
has
area
kind
like
of set
this?
up a lot of that, so
Okay.
through the local public health, that might be a good question for them, but we'll be a partner in any way that we can to help facilitate that. Okay?